The fourth speaker is coming from Australia, far away, and is from the Australian Institute for Bioengineering and Nanotechnology. Hello, Ms. Jing Wang. Thank you.
Thank you for your last introduction, and thank you very much for coming here to attend my presentation. Today I'm going to present a nanostrategy for dynamic monitoring of patient therapy response. So before starting, I would like to briefly introduce my PhD projects. I focus on the development of liquid biopsy-based nanotechnology for cancer diagnosis and therapy monitoring. I develop different nanotechnology to detect the urinary RNA biomarkers, blood protein biomarkers for the cancer diagnostic subtyping, and as well as the individualized risk assessment. I also work on the extracellular vesicles and the circulating tumor cells. I develop different nanotechnology to phenotype phenotyping EV and the CTC. I try to look at their heterogeneity and monitor their phenotypic evolution during the treatment. And today I will focus on the technology that's based on CTC Phenotypic Changes for the monitoring patient therapy responses. So why it is important to monitor the therapy response? This is because tumor is really heterogeneous. So it means different patients might respond to the therapy differently. So from a post-treatment clinical standpoint, it's really important to understand, to determine the impact of the treatment on the disease, the presence of residual disease, and the emerging treatment resistance. Circulating tumor cells release from the tumor and circulate in the blood. So it might be a potential biomarker to provide the tumor biology information. However, CTC are heterogeneous and rare. It only has 1 to 100 CTCs in 1 ml of blood. This really causes the technical challenge in CTC analysis. Cell search system is the only FDA-approved system for CTC detection. However, it's MCAN positive dependent, which means if the cancer cell has low MCAN expression, it will not be detected by this system. Also, it has really limited multiplexing capability because it's fluorescence-based result technology. There are some new technologies such as nanozyme-based calorimetric assay and electrochemical biosensor for the CTC detection. However, neither of them can provide very comprehensive CTC heterogeneity. So it's really important and necessary to develop a nanotechnology that has high multiplexing capability to enable us to look at the CTC heterogeneity and to look at their response to the treatment. I developed a third barcode system for the selective and sensitive drug targeted CTC detection. So what's third barcodes? Basically, it's just a gold nanoparticle functionalized with Raman reporter. So under the laser excitation, it can generate very unique Raman signal. And if you can also functionalize the third gold nanoparticle with other different reporter, and because the peak is really unique, so that this enables us to have a very high multiplexing capability and to look at the CTC heterogeneity. We can even functionalize the third barcode with antibodies, which allow us to specifically identify the antigens. So compared to the fluorophore, third barcode has high multiplexing capability, and it's also photostable. So using this third barcode system, we characterize the CTC phenotypes and monitor their phenotypic evolution during the treatment. So basically, we just label the circulating tumor cell with our search barcodes. So under the laser excitation, the CTCs within the laser beam will be detected. So for example, if we look at 4 biomarker expression in the CTC, we can get such kind of results. So in this figure, the different color corresponds to different biomarker. The location of the curve indicate the expression level of the biomarker. The white list of the curve indicate the heterogeneity of the diversity of the biomarker. Because the cell recipients in the solution are doing the Brownian motion, so with the continuous monitoring, some cells come into the laser beam, some cells go out. This enables us to look at different portions of the CTCs. So we hypothesize that the irradiation of the drug-sensitive cancer cell will lead to the decrease of biomarker expression as well as the diversity. We can also further calculate the average expression level of each biomarker. The relative ratio of each biomarker was defined as the CTC phenotype. So we hypothesize that the drug treatment will lead to the phenotypic changes. So in this project, we use the myeloma as the model. We typically look at 4 biomarker expression. MCSP and MCAN are highly expressed in myeloma. ERBB3 is involved in PI3K signaling pathway, which is relevant to the development of drug resistance. LNGFR is the stem cell biomarker, which also can indicate the development of drug resistance. So we look at these 4 biomarker expression in 10 myeloma patient-derived cancer cells. We can see different, each cell line possesses a very unique cell phenotype. For example, myeloma 35 cell line has relative high MCAN expression and low expression of other 3 biomarkers, and myeloma 64 has high MCSP and MCAN expression. Now we typically look at this 64 myeloma cell line. This is the search imaging from the same cell. Different is a first color imaging. Different color corresponds to different biomarker, and we can see it is calculated based on the characteristic peak of the search barcodes. We can see for this myeloma cell, it has relative high MCSP and MCAN expression, which is consistent to the cell signature I showed before. Now let's look at the diversity of each biomarker expression. We can see this cell line has relative diverse MCSP and MCAN expression. So we further validate our search data with flow cytometry result, which indicate that search result and flow cytometry result are consistent, and our technology can provide accurate CTC phenotyping. Now I use our technology to look at the biomarker expression during the BRAF inhibitor treatment. So I give this is a myeloma 33 cell line. We can see the initiation of the drug treatment lead to the decrease of MCSP diversity as well as the expression level. And with the continuous drug treatment, the diversity and expression level gradually recovered. Now let's look at the cell signature during the treatment. We can see on day 3, the signature changed a lot compared to the parental cell line without the treatment, and with the continuous drug treatment, the cell signature on day 3 since day 3 become more stable, and the cell signature on day 70 actually is quite similar to their parental cell line. And we we further define the signature we obtain on day 30 as the resistant signature. After demonstrate on the cell line model, we like to further test where our technology has the potential to be applied for the real sample. So we test in the simulated patient sample, we spike the myeloma cell into the healthy human blood after fecal and CD45 depiction. We label this cancer cell with our search barcodes, and then we detect its search signal. This is the image, search imaging data. This is the myeloma cell, the big one. The small one is the blood cell. We can see the search barcode can specifically target the myeloma cell rather than the blood cells. After demonstrating our technology can be used in simulated sample, we first apply it to monitor the patient sample response to the treatment. So for the patient 1, we monitor 4 time points. So day 1 is before the treatment, day 40 and 48 is under the treatment. We can see the CTC signature change under the treatment. There is impact the biomarker diversity as well as the expression level also change. Because of the toxicity, this patient stopped the treatment and the tumor progressed. So we observe a recovery of the CTC signature. This is another example. Patient 10. So we monitor 2 time points. On day 7, this patient started the chemotherapy, but this patient did not respond to the chemotherapy. So correspondingly, we observe no CTC signature change during the treatment. So this is the CTC clusters we obtained from this patient. To summarize, we developed a search-based nanotechnology for CTC phenotype profiling, which we also look at the CTC heterogeneity as well as the phenotypic evolution during the therapy. So in the future, we would like to use more patient samples for further validation, as well as we start to look at the immune point panel in the whole blood cells. Finally, I would like to thank my supervisor, Professor Choi and Dr. Wang, as well as our group members. I also would like to thank our collaborators. Thank you for your attention. I'm happy to take your question.
Thank you. For an elegant presentation.
Thank you.
Are there questions?
Yeah, just a basic question. In terms of sensitivity, so how many cells per milliliter your method allows to detect?
We can detect down to the 10 cells per 10 ml of blood.
Okay, so 1 per ml. Okay, a lot. Very good.
The final goal is, of course, to monitor the response to treatment.
Yes.
Via the circulating tumor cells and the phenotype. Yes. But how stable is the phenotype itself without treatment? So,
yes, we have a control experiment on the cell line without the treatment. It's relatively stable. We monitor 70 days, and the phenotype is still stable.
Okay, thank you. If no more questions, then we move to the last presentation. Thank you so much once again.